hope you have a wonderful time, and I thank you all sincerely for tuning in. Now, the big boy in the white coat is across from me, and that means business. James Garrity, good afternoon.
Jerry, lovely to see you today on a lovely day.
Let me say this, James, we're in a whole new dimension, because not alone are we going out live on Midwest Radio, we're also now from here on in going out live on the Midwest Radio Facebook page.
I believe so.
That's why you've dickied up and you have the white coat
Yes,
on.
I have the white coat on, washed and starched.
And for our listeners, we'll take this to about 3 minutes to 1 in the normal way, and then you and I will go to another studio and we'll continue to answer questions that haven't been answered before, in fairness to people, because
Fantastic.
So many things are coming in. Motorists are being advised to be cautious of travelling along the N59 in Sligo this afternoon. It follows reports of a bad oil spillage along the N59 between Screen and Ballysadare. Road users are being advised to use the route with caution today. James, before we get into the questions, a couple of items on the agenda.
There is, Jared, the first one is HRT. From the 1st of June, ladies are entitled to HRT free, which I think is a fantastic coming together of the Department of Health and the IPU. So if people can just pop into the pharmacies, have a chat with the pharmacist in relation to have to register for their DPS card or whatever. Yeah. But I think it's fantastic, and I think it's a great departure for ladies that are going through menopause, perimenopausal symptoms.
And James, no rigmarole, no hoops to go through, no bureaucracy.
No hoops, just have a chat with the pharmacist. We're all aware of it. Obviously, you know, with the new schemes and stuff like that, there'll be a couple of glitches here and there, but I think, you know, going forward, when everything settles down, it's fantastic news for ladies.
Item 2.
Item 2, I just wanted to give a heads up in relation to a wonderful study that came out recently in relation to exercise improves colon cancer survivor. Major study reveals, and I'll just go through, I'll just read a little bit of it, Jerry. The trial involving 889 patients put half on the exercise program. The other half were given leaflets promoting a healthy lifestyle. The results published in the New England Journal of Medicine, which is very prestigious, Jerry, showed after 5 years, 80% of people exercising remained cancer-free, compared with 74% in the other group, meaning a 28% reduction in the risk of cancer coming back or a new one forming. Meanwhile, 8 years after the initial cancer treatment, 10% of people on the exercise program died, compared with 17% in the group given only health advice, marking a 37% lower risk of death.
So what kind of exercise are we talking
Very
about?
mild, Jerry. What they're saying here is 30 minutes of swimming or a little bit of salsa dancing, any type of light exercise, Jerry.
And James, why would you say this pertains to colon cancer?
Well, this was the actual study that was carried out, Jerry, but ultimately what it is saying, I mean, just going back here to what Dr. Joe Hinson of the University of Leicester said, the results were exciting. He added, I saw firsthand that this reduced fatigue, lifted people's mood and boosted their physical strength. We know that physical activity regulates several key biological processes that could explain these results, and further research will help us uncover why exercise has such a positive impact.
That's amazing.
So I think the most important thing here, Ger, is if people are going through a difficult time, whether it's with chemo, cancer, obviously this is done on colon cancer, but that half hour every day, whether it's to go for a walk, go for a salsa, go for a swim, just to get that into their daily life. It's very, very important.
You know, and now that science has backed this up, that makes it even more important.
Absolutely, Jerry. And I think there's going to be a lot more work put into that.
Item 3 is relation to bacon and cabbage.
Well, I'll tell you what, Jerry. I went around the other night to the wonderful Jack Lundy of Lundy Foods.
Oh, I know Jack, a gentleman.
And he did up bacon and cabbage with a floury potato.
Oh, why do you bring that up now?
It was exceptional, Jerry, with a little dab of butter and salt. And I was asking Jack how he made it so wonderful, and he mentioned to me that he actually puts the bacon in with the cabbage.
Oh, yes.
And boils away. Now, I have to say that my wonderful mother would do the bacon on its own and then add it near the end.
Yes,
to
I've
the
seen
cabbage.
That done too. Yes.
And I have to say, but there's one meal, Jerry, that makes the hair raise on my wonderful head, is the bacon and cabbage.
And when you put the floury spud in there like you did, that is the crowning glory.
Incredible, Jerry. Isn't it incredible how certain foods to just...
Thank you very much.
Move you back to when you were a kid.
Of course, you did this now in the beginning. You'll have us like two savages in here now. Brendan Shine did a song once upon a time called I'm a Savage for Bacon and Cabbage. Well, and you've us like savages now. Anyway, look, let's get down to business, Jerry. James. A lot to do. James suffer a lot from dry nose, dry mouth and stuffed head. All allergy tests are clear. Could it be blood pressure? meds, could it be blood pressure meds that's causing it? I'm on, is it Omesar and Plendil? Any suggested remedies, please?
Yes, Ger. Well, obviously this patient here has high blood pressure. They're on felodipine, which is the generic name for the Plendil, and olmesartan, which is the Omesar. Those two combined will be helping to reduce down the blood pressure. But there is fundamentally this issue where you can end up with side effects from different types of medicine or the combination of different types of medicine. What I would be suggesting there to that patient is, number one, they have a dry nose and they have a dry mouth. What I'd be suggesting there is, number one, make sure the GP is aware and the pharmacist are aware that you're getting these issues with the medicine. Number two, for the dry mouth, you can get a little product. It's like a toothpaste or a gel called Bio Extra. You can just use it on a toothbrush. The other thing what you can use is you can use a little bit of maybe a nasal spray, like a Sterimar nasal spray that'll take away that dryness for you in the nasal area. But it's very important that the GP is made aware of these actual symptoms because they could be coming from the actual medication.
The medication.
Yeah.
James, hello. James and Jerry. I'm a female aged 31. I have diabetes type 2 and I take metformin 850 milligrams every morning and evening on no other medication. My blood sugars are up and down as I have to test it several times a day. Lately it's reading under 3.9, but my main question is my cholesterol as it's at 2.2. Has my diabetes anything to do with my cholesterol being so low? I'm a diabetic for the past 5 years. Any advice, please, would be appreciated, as at times I feel very weak and dizzy, and I can't get an appointment with my GP for another 2 weeks. Thank you and love the show, says Lisa Ann.
Well, Lisa Ann, I would be slightly concerned, and I have to be honest with you,
Yes.
Jerm. The metformin 850 milligrams, I'm just wondering, has this started recently or is this ongoing? The fact that she has diabetes 2 is the reason she's on the metformin 850 milligram, but anything below 3.9, the doctor needs to be aware of that. The GP needs to be aware of that. There is an issue there that the cholesterol may be affected by the diabetes. It's called diabetic dyslipidemia. Okay?
Wow.
So, you know, I do think it's okay ringing up the GP surgery and saying, I'd like an appointment. But I would expect Lisa Ann to give a call to the GP surgery and say, these are some of the figures that are happening here. I need to talk to my GP, and that's important that that's done sooner than later, because anything under 3.9 is low, Jerry, in relation to the sugars. The cholesterol at 2.2, you know, the diabetes number 2 can have an impact on cholesterol, the bad fats, the good fats, and total cholesterol reading. So it needs to be reviewed, and 2.2 is very, very low.
So would you suggest, James, that Lisa Ann make that call today?
Absolutely,
Okay.
absolutely. Just go and get that for peace of mind, Jerry, because that would unsettle me, and I have to be honest with you.
Yes, you have. Absolutely. Okay. And Lisa Ann, we wish you well with that now.
Yeah.
Just a query for the health tips segment with James, please. I'm a 74-year-old male, had a hip operation 2 years ago, and have been left with drop foot and nerve pain. Can you recommend anything?
Yeah, well, sometimes
What's drop foot, James?
Drop foot is where the sometimes the sciatic nerve can get a little bit impinged, and it leads the foot to drop effectively. And what I was going to suggest to that patient is definitely I would suggest omega-3, vitamin B complex, and physiotherapy. That needs to be looked at, because sometimes you can get an orthopedic or insert that will actually help that. But easing down in that pain area, there is actually a product as well that I would recommend to that patient called Nubit, N-U-B-I-T. And sometimes the patient had a hip operation, sometimes you get a little ding on the nerve area, and it can affect the myelin sheath jar, and that can actually then get this thing called referred pain and drop foot. But to help promote the healing, if we do something like omega-3 and vitamin B complex or Nubit over a period of 8 to 10 weeks, that could have a significant improvement.
James, I think this must be magnesium, James. Can you take magnesium when I'm on Xarelto, 20 milligrams blood thinner? Get pins and needles on my hands in bed. Thank you, says James.
On the law of averages, I would say yes, Jar.
It's magnesium. It says magnesium, but I presume it's magnesium, James.
Yes, Jar. And obviously there's different forms: magnesium citrate, oxalate, threonate. There's different forms of magnesium, but in general, it don't interact with Xarelto, which is an anticoagulant. We always have to be wary about anticoagulants. We think of thinning in the bloods, and you know, the original, the warfarin. So everybody, even as a pharmacist myself, I'm always wary about even, say for example, different foods with high levels of vitamin K in them. You have to always be careful. So what I would say to the person, I have no problem in taking the magnesium, but just be aware, you know, if you are getting any bruising or anything like that, and then we'd have to review it again or have a chat with the GP.
Okay. Next question, James. Is it okay to take Viagra at 75?
There should be no reason not to, Ger, if the person is in generally good health. If they have a chat with their pharmacist, you can get it over the counter.
Thank you. 83-year-old lady has a lot of achy joints and pains. She has atrial fibrillation and is on medication. Is it Eliquis, James? And
Yes.
Flecicide,
Yes, flecainide.
flecainide
Yep.
for this. Could James recommend something?
Well, Ger, if we just look at the lady, she's 83, all right, and she has atrial fibrillation. Now, the atrial fibrillation is being controlled by the flecainide, which basically manages the heart rate. And then we have Eliquis, is just basically to manage the potential of blood clots. Now she has achy joints and pain, so we have to be careful here, Ger, because again we're looking at Eliquis, and Eliquis has a big interaction capacity. That means it can interact with a lot of herbal medicines, OTC medicines. So the lady has to be very, very careful. What I would respectfully suggest to her is something like a gel to massage into the affected areas where they're quite sore, and maybe using something like paracetamol. But if she popped into her pharmacist and had a little chat there, what could she use with those two medications? You know, you could use some paracetamol. They could do an interaction check on some of the anti-inflammatories, but a lot of them, Ger, do cause a slight thinning in the blood, so you have to be very, very careful.
As regards the gel, would you recommend a specific one?
Say for example, Diclac, Ger. Now the reason I'm recommending Diclac capsules by themselves can cause blood thinning, but the gel is absorbed locally. You know, so using that in and around affected area it should be quite safe.
What does James think of the injection for losing weight?
I think the more information that comes out about the GL, what are called the GLP-1s, Jerry, are is very, very positive. You've got the likes of Wegovy, which is manufactured by Novo Nordisk, and you've got Mounjaro, say by Eli Lilly. One of them is over a period of time is recommending a weight loss of about 16% with the Wegovy and maybe 23% with Mounjaro over a period of time. But you know what, Jerry, my experience, it tells me one thing here, that those injections are also giving rise to really incredible positive heart impacts and overall body well-being. But it's really important, I would say, the triangle of life: the injection, lifestyle, and exercise.
Thank you.
You know, this idea of taking an injection and the way it's going to fall off you. I have seen it myself where people have said, geez, James, this injection is great. 6 months later, you know, they lose a couple of stone, and you'll meet them 18 months later and it's all back on. And you have to take into account the exercise factor and the lifestyle factor. The science behind those GLP-1 injections is incredible. And I think going forward, they're going to have a really positive impact on people's lifestyle, but they have to take into account and take responsibility for health and lifestyle and exercise.
How often does one get that injection?
You can get it once a week, Ger.
Once a week.
Once a week. It's
yourself.
You just take
you administer yourself.
Self-injection, Ger. It's really good. It's incredible. It's
under doctor supervision.
Obviously under doctor supervision, Ger. But it's quite humbling to see what research and what doctors and what pharmacists and biochemists and the whole pharma industry is coming out. It is really quite incredible.
Approach.
And ultimately, this all came out of diabetic research with Novo Nordisk and Eli Lilly. And they have gone on to, in my opinion, make medicines that are really, really going to help people.
A man in his early 60s has a desperate pain on his right side. It's affecting his belly button. His belly button starts to protrude and he has to push it back in. He can get his belly button back in, but while he's pushing it, his side and belly button are very painful. He's waiting for an outpatient appointment. What would James say?
It sounds to me, Jerry, like it's an umbilical hernia.
Okay.
So sometimes the gut can protrude. You know, sometimes we got an inguinal hernia, where the gut descends into the scrotum, say for example in men, or you'll get you know, there's another type of hernia as well where it can go through the diaphragm right up into the tummy area. It'll come back to me. And there's this particular one, the umbilical hernia, it can come out through the belly button, and that needs obviously for a GP to look at that, and it can be repaired. That's the most important thing. But you know, he's waiting for he's actually he is waiting for an outpatient appointment. So that's very positive, because they will be able to get that sorted.
Good man. All right, now we're going to take a break for a minute. A couple of other things to do this side. Jerry, can you say shout out to all the boys and girls in Swinford, which I did, and I want to wish you well. Jerry, happy birthday to Stephen Nocton in Glenamoy from all the gang in Enver. Happy birthday to the best daughter and friend Stephanie McGing from all our family and friends. You're on the cook. We'll give you a cooking slot next. That's how I cook the bacon and cabbage. Cook the bacon for a while, and then you add the cabbage afterwards, and that is delicious. And good luck to the Glencorrib card game, which is on tonight. All are welcome. All the other questions pertain to you. We'll take a break. We're back again live in a couple of moments' time.
The Mid-Morning Show on Midwest Radio, thanks to Harrington Concrete and Quarries.
Strength cattle slats being...
So we'll go back to it. By the way, live on the Midwest Radio Facebook page as well today with James. Jerry and James, can you give out the name of the medication to lower cholesterol that you advertise in the radio? And can you also recommend something for joint pains?
Okay. Well, I'd usually recommend something called resveratrol, Jerry, which can be taken with your prescription-only medication. And also in combination with the resveratrol, you could use Reggie's Rice, which are very natural but reduce down the cholesterol naturally. What I would say about that, it's important to have a little look at the diet, or even just bring in a little bit more soluble and insoluble fibre into your diet, a little bit of multifibre plus, a couple of teaspoons every day over a period of time. And if you're half right with your diet, maybe half an hour, as we discussed earlier on, Ger, around the exercise, that'll have a big impact on your numbers.
Fantastic. James, I have tried different toothpastes to whiten my teeth, but no success. Would you recommend one?
I can't, Jerry, because I don't know. I use any toothpaste that's in front of me. That's the one I use, and I'm being honest with you. And but I definitely, going down that road, you definitely need to be talking to a dentist.
A dentist, okay. James, recently I got very tired in the evening for about 2 hours, and then I'm fine again. I've had my bloods done, and they're okay. I'm very fit. I take, is it Acercal, James? Is that right?
Acerol, yeah.
And Gastro daily. Is there anything you could recommend? I'm in my early 70s. Now, will you go back to the two products? What are those products?
Yeah,
for?
the Acerol Ger is a hypertension medication. It's made up of amlodipine, which is a calcium antagonist, and perindopril, which is an ACE inhibitor. Now, the combination of those two medicines, the patient has probably been on them quite a while. The gastro, I'm unsure of. It's probably something for stomach, Jerry, yeah. The combination of them should be fine. There's a long history of good results and good reports and low side effects with those medicines. And they did say, I'm very fit and I take those two medications regularly. I reckon the patient just needs a good tonic for a period of about 8 weeks.
Which one would you say?
Well, I would go with the Benefits multivitamin tonic. Okay. The Vivioptil Jar, very good tonic, or the Energy Plus capsule if they don't like a liquid.
Okay.
Yeah.
James, if you know anything that helps a person with peripheral neuropathy on the feet, already on a low dose of Lyrica.
Yeah. Okay. So the Lyrica there, Jerry, usually it'd be about 25 milligrams per gabalon.
What does pregabalin mean, Jim?
It basically deadens the nerve area, so it stops the tingling or the neuropathy coming from the feet area. But I would add in there B complex and magnesium for about 8 to 10 weeks. When we often talk, Jerry, here, some people would say, I tried for 2 weeks, James, and it didn't work. You got to have consistency over a period of time, minimum there for about 2 months, and use the magnesium and B complex, and that may help. It will also help the Lyrica as well, Jerry, so the effect of it may improve, so they should decrease with that neuropathy.
Okay. James, a few weeks ago I got a cramp in my leg, no power above the knee on the inside. I got out of bed, shook my leg for 15 minutes, and the sensation was just like a clamp squeezing my leg. Hard that you can happen swimming, says Vincent. And clearly Vincent wouldn't have been swimming though
I'd say he got a cramp, Jerry. I heard you can happen swimming. Well, I got one this morning when I was swimming, Jerry. And what I would say to Vincent there is, if he's ongoing with cramps, to get some electrolytes. There's really good electrolytes out there. The Diorolite SIS, one. There are a number of brands there, and they're fizz up into a lovely thing. And to do that for about 2 weeks, Jerry, just to get the electrolyte balance right. Usually magnesium is very, very important, for example, Jerry, in what's called the actin-myosin contraction in muscle. And if there's any imbalance in that at all, you can lead to cramping. Okay. So from that perspective, and it could be a fact as well, that could be a lot of lactic acid in the system. So if they pop into any pharmacy or health store and get some electrolytes and use it for a period.
And you can get these over the
absolutely,
counter. Good enough,
absolutely, and very, very good. And they've been given to babies and adults for years and years. But the benefits are not of them now. They're becoming like a lifestyle drink, Jerry.
Right, okay, good enough, yes. Now, James, a lady has pain in the sole of her foot near her toes. She's in her 70s. It's very painful at times. It comes and goes. What can she do?
The feet I've had my journey with feet over the last 6 months, Jerry, and I definitely recommend going to see a podiatrist on that. If you pop into your pharmacy and temporarily get an insole with a gel at the front, there's a lot of makes out there, Jerry, that can do that. And what that does, it'll ease the pressure on the front foot. But she needs, in my opinion, to see a podiatrist. Have a look at where the issues are arising and then take it from there in relation to the treatment going forward. Because even if the podiatrist has a look at that and sees that she could have a fallen arch, there could be issues around the front of the foot. So the important thing there is to try and manage that and stop it from reoccurring. Because ongoing, if she continues to walk on that, she's going to start walking with different pressures on different feet, and that can have issues for the knees and the hips.
Lovely. James, any suggestion, please, for burning feet?
Burning feet, which one is
Just
that?
straight.
Oh, yes, I see that, Ger.
Yeah.
Burning feet, I'm a great believer in magnesium and B complex for 2 to 3 months, Ger.
Over the counter.
Okay, over the
again.
counter. And at night time, a bit of Epsom salts, the wonderful ultra pure. If you get a 5 kilogram tub there, and put in 2 scoops or 2 fistfuls into a nice warm bath of water in the evening time, and just let your feet rest for maybe about 10-20 minutes in it, and see how that works for you.
Okay. Now, another lady on a Good Health product, and the Good Health product gives her tummy cramps and she feels nauseous. She tries to take the product every second day and still feels horrible with cramps. I suffer with diverticulitis. I'm 54 years of age. Should I continue taking the product, James? Regards, as Yvonne.
Well, what I would do there, Yvonne, is I would take it in the morning with your breakfast, okay? Mix it with extra water for a period of about 2 weeks, and see, does those tummy cramps ease up? The fact that you have diverticulitis, it might be suggested that you might have a little infection in the gut. So that if that isn't cleared up within 2 weeks, I'll be talking to the GP.
Okay, get further. Okay. Swelling on the foot, which goes down to the instep. What would cause it? And could James recommend anything?
Given my journey over the last 6 months, as I said, Jerry, I would definitely recommending the patient there to pop into your pharmacy first of all, get a set of insoles, have a chat with the pharmacist, see what they can do. But most certainly, the podiatrist is the key there. They're wonderfully qualified, and if you're not walking right, and if your feet are sore, it can be very debilitating.
Okay. Now, another caller takes selenium, zinc and vitamin D tablets all year round. Also magnesium tablet, but not every day for the magnesium. Would it be okay to take a break for a few months during the summer from the vitamin and selenium? Thanks, regards, Suzanne.
There's absolutely no reason why they can't take a little vitamin break, Jared, just for a couple of months.
Yeah.
But the fact that they're taking the selenium and zinc and the vitamin D, it's a really nice combination there, because the selenium by its very nature is very good in antiviral, and the vitamin D and zinc is very good at promoting your immune system. So from that perspective, Jerry, it's a lovely little combination the lady has going on there. Take the little break, for 8 to 10 weeks, and then go back on them, especially for autumn winter.
Now, please ask James, could you help me? I have wind in my stomach when I stand up after sitting down. I live in London and I listen to Midwest Radio every day. I'm originally from Mayo. Many thanks, says Maureen. Thank you, Maureen.
Just run that one by me again.
I will. So Maureen lives in London, first of all. Now, she has wind in her stomach, James.
Yep.
And when she stands up, when I stand up after sitting down, it seems the wind. So she's sitting down and then she decides to stand up and the stomach becomes very windy.
Okay.
What do you think is going on?
Well,
there?
what we have is a little bit of probably bad bacteria in the gut area, Jerry. So what we want to do is we want to overrun them. So if that lady pops into a good health food store or pharmacy in London, is this in London?
Yes, from Mayo originally.
From Mayo originally. Well, pop in there and they should have a probiotic and go on that along with, say, something like peppermint oil capsules. They'd be the two things that I know would be available in the UK that will help her. And if she's still struggling, if she can give ourselves a ring, we'll send her over something that'll help her as well.
Perfect. Now, one more in this section, and then we'll go live in part 2 in about 3 minutes' time. James, I had a scan of the liver and it showed I have a fatty liver. What can I take for it, and what's good to detox your liver?
Most certainly to observe the diet. Bad fatty foods are not good. And is the patient drinking, Jared?
Didn't say.
Okay, so we just need to be aware of that. And if the pop in and get some Benefits liver support is very, very good for that, Jared. And do 1 or 2 capsules a day. Take it in the evening time. That'll really help with the liver detox. And do that for about 2 to 3 months, and that'll help. But it's important, Jared. Usually what people do is they'll just usually scan that maybe in about a year and a half's time, just to make sure that there's no other issues around that area.
Now, for our listeners who can't rejoin us on Facebook and Appearance Live, James, we're leaving it at that on the radio. 096 60072 is your contact point. And of course, you have the website as well, which is Malloy's Pharmacy.
MalloysPharmacy.com.
MalloysPharmacy.com. Thank you, James, for this part. You're back next month on the radio, and we're going live again on Facebook in about 3 minutes' time.
The Mid-Morning Show on Midwest Radio. Thanks to Harrington Concrete and Quarries, leading supplier of high